Hi there, I'm Dr. Tingle. I see we have you in for a cranial nerve exam today, correct? Alright, well, on your chart it also said that you are being referred for this exam today because you are having trouble sleeping. So, we are going to give you a very thorough cranial nerve exam today, going over your senses of touch, sight, taste, hearing, and smell, and see if we can't figure out why you can't sleep, okay? Alright, so why don't you have a seat right there, and we are going to begin the exam with me doing a very brief overview exam of your face, scalp, outer ears, neck, and jaw, okay? Alright, and feel free to close those eyes during any portion of this exam, except when I say no. Alright, so just stay still for me. Come over here, just go through your scalp real quick. Just looking for any kind of contusion, bumps, bruises, anything that might be causing those sleepless nights of yours. Okay, I'm just going to move down to the temple here. Just going to just palpate your temples gently. Good. Okay. Now I'm going to touch your ears a little bit. Okay. Just do a outer ear inspection here. Just looking around on the earlobe here. Good. Into the auricle. Just going to gently palpate that. Good. Just going to pinch a little bit there. Good. Any pain or discomfort? Very good. Alright. I want to look at the other ear now. Same thing. Just going to gently inspect. Okay. Good. Alright, very good. Well, there is no outward signs of any damage or anything that could be causing you sleeplessness on your scalp or ears, so that's good. But I'm going to continue examining your face real quick. I'm going to be going over your forehead, your sinuses, and your jaw. Alright? Okay. So if you like, keep those eyes closed, and I'm just going to gently press on your forehead here. Press, 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 press. And let me know if there's any pain. Good. Alright, so starting from the sides of your temples, I'm just going to work my way down your face, okay? So I'm just going to palpate. Good. Good. Okay. Good. I'm going to feel down around your jaw here. Okay, keep your head straight for me. Good. You let me know if there's any discomfort, any kind of pain, alright? Okay, good. Just looking for any bumps, swelling of the lymph nodes, things like that. But I'm not finding anything, which is great. Okay, I'm going to palpate your sinuses real quick with my thumbs, and I'm just going to go just like this, right along your sinuses, and you let me know if there's any pain, okay? So, just relax, and good, good. Just relax. Good. No pain? Very good. And now we are going to look at your nose and just palpate down your nose and your T-zone, looking for any kind of signs of abnormality or pain, obstruction, or anything that could be causing you any kind of discomfort. Because sleeping with a blocked nose does not lead to a good night's sleep. So just let me check your nose. Good. Any pain? Wonderful. So now we are going to get into testing your cranial nerves, starting with your sense of taste. Okay? So first I'm going to do a little bit of an oral inspection on you, just to make sure that there's nothing obviously wrong with your mouth, which I'm sure there is not. But we're going to do a little oral inspection and then a very easy taste test, okay? Alright, so I'm just going to grab my light and we will begin. So now we are going to do a brief oral inspection on you. So if you would just look straight at me and say, ah, I'm just going to take a look inside your mouth. Good. Good, not seeing any outward signs. Any problems? No. Redness, splotchiness? No. Signs of swelling, so very good. Wonderful. So now we're going to do a taste test with you. I have in here some flavored liquid, so I'm going to ask you to close your eyes, stick out your tongue, and let me know what you taste, okay? And here we go. 1, 2, 3, drop. And what do you taste? Lemon. Very good. We're going to do one more of those. And keep that tongue out. 1, 2, 3, drop. And what do you taste there? Coffee. Very good. Alright, go ahead and open your eyes. Blink a few times, clear them out. So, your sense of taste is very much intact. So we are now going to go on to your sense of smell. I'm just going to ask you to occlude one nostril for me real quick and breathe in. Good. Now occlude the other. Breathe in again. Good. Have you had any sense of smell loss in the last 2 months? No? Okay. Very good. So what I have here is a small mister that will spray out a mist, and I would like you to tell me what it smells like, okay? Alright, so close those eyes and tell me what you smell. Lavender. Very good. Alright, go ahead and open your eyes. So, for the next portion of the exam, we are going to be inspecting your ears and doing a hearing test, okay? Alright, so to begin, we're going to do some very, very simple hearing tests where I would like you to keep your eyes closed, and you tell me which ear you hear the sound in, okay? Alright. And here we go, and good. Very good. Good. Keep those eyes closed, and I want you to repeat back the word that I whisper in your ear, okay? Alright. Relax. Good. Pineapple. Good. Coconut. Coconut. Good. All right. You can open your eyes now. We are going to now look inside your ears real quick. Just going to put on my otoscope attachment. And we will take a look inside your ears. You see, just a little light. And if at any point you feel any discomfort, you let me know, okay? Alright. So just relax. You can close your eyes. And we're going to just look inside your ear over here. Very good. Okay. Ear canal looks good. Tympanic membrane looks nice and pearly white. Very good. Alright. And not too much wax in there, which is great. And we're going to take a look at the other ear over here. And we're just going to slip this inside. Slip inside, okay. Alright. Looks pretty good. Not a lot of wax built up. Alright. Wonderful. Now, part of the cranial nerve exam is the sensation test. And since you are here for sleeplessness, when we want to be very thorough, I am going to also perform a little sensation test on your ears. This is an acupressure tool. It's very dull, and it also is spring-loaded. What this does is allows me to poke and wiggle and stimulate different parts of your ear in different pressure points. And these can help bring on feelings of relaxation, calmness, and even help ease tension and help you sleep. So I would like to do a little sensation test, make sure that everything is good, and we might be able to even help you sleep a little. So just relax. And I'm just going to come over to your ear here. I'm just going to hold it real gently. And we're going to just poke and wiggle. Good. And you can feel this, right? Good. Poke and wiggle. Poke and wiggle. Good. Good job. Okay, and over here too. Good. Good. Okay. Just poke and wiggle. Poke and wiggle. Poke and wiggle. Alright. Any pain or discomfort? Good. Well, your ears are perfectly fine, so we are going to move on to the next portion of the exam, which is the eye portion. So we will be testing your sense of sight and doing a very thorough examination, okay? I'm just going to grab my other light and we will look inside your eyes and do some very relaxing eye tests for you. Alright, so to begin the eye portion of the exam, I am going to be examining your eyes by taking a very close look inside of them with my light here. So, as you can see, it's not very bright. It will not hurt, but I'm going to get very close. Hold your eye open and take a look inside. So just stay still for me. I'm just going to take a look. Take a look, okay. Alright, look up for me. Good. And look down. Good. Look left. Good. And look right. Good. Alright. Well, everything looks good there. We're going to take a look at the other eye. Same thing. Just Just stay still. I'm just gonna take a look inside. Look inside. Okay. Alright, look up for me. Good. And down. Good. Left. Good. And right. Good. Wonderful. Well, everything inside your eye looks great. So why don't we do a little ocular motor function testing, okay? So this is very simple. You look straight at me, and I want you to just look at my finger. Okay, good. Now over here. Good. And over here. Good. Look at my finger. Good. Don't pay attention to the other finger. Focus right here. Don't pay attention. Just focus. 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 Good. Now I want you to follow my finger with your eyes. Keep your head straight. Good. Keep that head straight. Good. Wonderful. And now I want you to tell me when you can no longer see my fingers. Good. Good. Same thing. Tell me when you can no longer see them. Good. Good. So good. So far. And now we are going to test your pupil response with the swinging light test. So I'm just going to occlude an eye like this. And I'm going to swing the light in and then back out, okay? It's very easy, very simple. We're just going to cover one eye. We're going to swing in, good. And down, good. And we're going to swing in. Down. In again. In, out, in, out. Very good. All right, and over here, swing in, out, swing in, out, swing in, out, swing in, out, in, out. Very good. All right. Well, your pupils were perfectly fine and functioned absolutely wonderful. So, I want to do a few more tests on those eyes of yours, though I don't suspect any problems whatsoever. But just look at my finger and don't pay attention to the light. Don't pay attention to the light. Just look at my finger. Good. Good. Good job. I think your sleeplessness may be stress related, but we can get you to a very good sleep clinic that can help you relax, de-stress, and get back to a normal sleep schedule. But I have to say, I think your eyes are perfectly fine. So we are going to move on to the final portion of the exam, which is the touch test. This is the most relaxing portion of the exam, and if you happen to fall asleep during it, that is perfectly fine, and frankly, we'd be happy to see that. So, for this portion of the exam, I'm going to ask you to close those eyes again, and I'm going to be touching you with some different objects on different different parts of your face, okay? And you're going to let me know what that object is. So we're going to start with something very simple. This will be dull, and I'm going to touch your ear with it, like that. And this will be soft, little brush, and you can feel that. Alright, so close those eyes, and touch. Dull, very good. Touch. Soft. Touch. Dull. Good. Touch. Soft. Touch. Soft again. Touch. Dull. Good. Touch. Soft. Touch. Soft. Touch. Soft again. Good. Touch. Dull. Alright. So, I think your sense of touch is very much intact. However, there is one more touch sense we need to test, and that is the pain response. However, we are not going to hurt you in any way, I promise. We're just going to use this small pinwheel and just gently run it on your neck and parts of your face to make sure that your pain receptors are still working. This will not pierce the skin. You will only feel a very, very, very light prick. And honestly, you will probably not even notice. So just relax. I'm just going to touch. You felt that? Good. And over here, one more touch. Good. And up here, touch. Good. See? Not so bad. But I do have to say, I don't think there's anything physically wrong with you. I think maybe you are just a little stressed, and that's not letting you get a good night's sleep. So I'm going to write you a referral to our sleep clinic practice. They will help you relax and get a good night's sleep. And if you need us, you know where to find us. And please call us anytime. Alright? So you go home, get a good night's sleep. Alright? Just try to rest, relax, hydrate, watch your favorite show or movie, and just try to decompress. And if you need us, we're here. And I'll see you soon.